The first assessment we used is Mini Mental State Examination, in short, MMSE. The tools needed for this assessment are a wristwatch, a pencil, and a blank piece of paper with the printed sentence, "Close your eyes." This assessment is used primarily as a screening tool for the detection of cognitive impairments and dementia. Apart from that, it is also used for patients with cognitive dysfunction, traumatic brain injury, stroke, and psychiatric conditions.
Hi, so the first assessment that we're going to demonstrate is Mini Mental State Examination. My name is Christina and I will be the therapist. This is Naili, she will be the stroke patient. The tools needed for this assessment is a piece of paper with "Close your eyes" written on top and this picture drawn below, a pencil and an eraser. Okay, so without further ado, let's start the assessment. Okay, Assalamualaikum, Miss. Hi. My name is Christina. I'm your therapist today. What's your name? Wanaini. Miss Wanaini. Okay. How are you today? Good. Okay. So today I'm going to ask you a few questions. Is that okay? Okay. So the first question is, can you tell me the date of today? October. Okay. October. So what year is it? 2018. Alright. The day. What? Thursday. Okay, the day, Thursday. Okay, October 2018. The date. What day is it? 15. Oh, okay. Can you tell me what season we're experiencing? Season, yes. Okay. Can you tell me where we are right now? Hospital. What hospital? Putrajaya. Okay, which floor? First floor. Alright. Putrajaya. Where is Hospital Putrajaya? In what town or what city? I don't know. Okay. What state? Selangor. Okay, what country? Malaysia. Alright. Alright. I'm going to name 3 objects and then I need you to remember all 3, okay? Because I'm going to ask you the 3 objects later. Okay, the first one is car. The second one is table. The third one is lamp. Okay, can you repeat that? Car, table, lamp. Alright, very good. Alright, now we're going to do some calculation. I would like you to count backwards from 100 by 7. As in, okay, 100 minus 7 is? You don't know. Okay, alright, never mind. Okay, can you spell the word world backwards? Earlier, I told you the names of 3 things. Can you tell me what those were? Table, okay, pencil, check, okay. Okay, can you tell me what this is? Watch. Alright, very good. Can you tell me what this is? repeat this phrase. No ifs, ands, or buts. No ifs, ands, or buts. Very good. Okay, right now, I want you to take this paper with your right hand, fold it in half, and put it on the floor. Alright, very good. Can you give me back this paper? Alright, now I want you to read this and do what it says. Close your eyes. Okay, very good. Okay, now I want you to write a sentence, any sentence, but the sentence have to have a noun and a verb. Very good. Okay, now I want you to copy this picture, draw it below. Make sure it is the same exact shape. Okay? Mini mental state examination. For question 1, which is time orientation, the patient scored 2 out of 5. This is because she was able to give the correct answer for year and day of the week, but she was unable to give the correct answer for what season, date, and month. For question 2, which is place orientation, the patient scored 3 out of 5. This is because she was able to give the correct answer for what country, hospital, and floor, but she was unable to give the correct answer for what state and town or city. For question 3, which is registration, the patient scored 3 out of 3. This is because she was able to state all 3 objects with one trial. For question 4, which is attention and calculation, the patient scored 2 out of 5. This is because she was only able to spell the first 2 alphabets correctly for the word whirl backwards. For question 5, which is recall, the patient scored 1 out of 3. This is because she was only able to recall 1 object out of 3 objects that was mentioned earlier. For question number 6, which is naming, the patient scored 2 out of 2. This is because she was able to name all 2 objects. For question 7, which is repetition, the patient scored 1 out of 1. This is because she was able to repeat the phrase correctly. For question 8, which is 3-stage command, the patient scored 2 out of 3. This is because she was only able to follow 2 commands correctly. For question 9, which is reading, the patient scored 1 out of 1. This is because she was able to read the instruction and do what it says correctly. For question 10, which is writing, the patient scored 0 out of 1. This is because she was able to write a sentence, but it does not contain a noun and a verb. For the last question, which is drawing, the patient scored 0 out of 1. This is because she was unable to copy the picture correctly. The patient's total score is 17 out of 30, which indicates severe cognitive impairment.
The second assessment used is MASA, which stands for Mann's Assessment of Swallowing Ability. The tools required for MASA includes some crackers, a spoon, and a glove. MASA is designed as an initial screening test for bedside evaluations to assess patients' swallowing ability. It is also used for patients with acute stroke or elderly pneumonia.
Hi, my name is Nasira and I will be the therapist for today.
And I'm Nur Hidayah. I will be the patient today.
And today we are going to be doing Mann's assessment for swallowing ability. Hi, good morning.
Morning.
How are you today?
Good.
Alright, great. So today I'm just going to be doing a short assessment just to see your swallowing ability. And I'm going to be asking you a few questions and we're going to be doing a few activities. Would that be okay with you?
Okay.
Alright. So we're just going to start by your name. What is your name?
Hidayah.
Alright, good, Hidayah. And do you know where we are today? Miss Hidayah? Miss Hidayah?
Yes.
Are you okay?
I'm okay.
Alright. Do you know where we are today?
Hospital?
Yes, very good. Do you know who brought you here today?
My son.
Alright, is he outside right now?
Yes.
Okay. Do you remember what day it is today?
October 2018.
Alright, that's good. So, when you eat or drink, do you notice any saliva escaping from your mouth?
No. But I think sometimes.
Sometimes? Does it happen? How about when you chew? Do you notice anything coming out?
No.
Alright, are you sure?
But I think sometimes.
Okay. How about when you're not eating? Do you notice anything coming out still?
No.
Even when you're talking?
I think yes.
A little bit?
Yes.
Okay, alright, very good. Alright, now, Miss Hidayah, we're going to start doing some lip seal activities. Okay, can you repeat after me? I. Good. How about you?
You.
Right, very good. Okay, now can you see the two letters together like this? I, you. Alright, very good. Okay, next, can you take this spoon and just place it all around your mouth like this? You just put the whole thing in your mouth. Okay, can you try? Alright, very good. Okay, and for the next one, I just want you to blow air into your cheeks like this. Alright, very good. Alright, now, can you just try to extend your tongue as far as possible like this? Okay, now you try. Just as far as you can. Alright, good job. Okay, now I just want you to try move your tongue to the corners of your mouth like this. Can you try? Alright, nice. Okay, next, can you just clear the inner part of your mouth between your teeth and your lip like this? Okay. Alright, very good. Alright, so lastly, just can you put your tongue on the roof of your mouth and hold for a while? Like this. Yeah. Okay, very good. Alright, Miss Hidayah, for this next test, I just want to see how your tongue strength is. So for that, I'm going to have to use a glove. Now what you're going to do is you are going to push your tongue as hard as you can on my finger, okay? And just push it straight. Okay, can you try? Alright. Okay, very good. Okay, now we're going to try do the same thing. You still have to push, but this time you move your tongue up and down. Okay, can we try? Okay, very good. You're doing a great job so far. Okay, so for this last one, you're going to still be doing the same thing. You have to push your tongue as hard as you can on my finger, but this time you move side to side, alright? Okay, 1, 2, 3, start. Okay, very good. Alright, Miss Hidayah, now I just want to see your tongue coordination. Can you just try to lick all around your lips using your tongue like this? Okay, can you try? Just make sure you get all the surfaces of your lips. Okay, alright, very good. Okay, now can you repeat the word ta for me? Ta. Okay, good. Now can you say ta 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 ta? Ta 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 ta. Okay, good. Okay, can you repeat the sentence? Take Tim for tea.
Take Tim for tea.
Okay, very good, Miss Hidayah. Okay, next we're going to try ka. So can you say ka?
Ka.
Okay, good. Can you repeat that like this? Ka 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 ka.
Ka 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 ka.
Okay. Can you repeat the sentence? Can you keep Katie clean?
Can you keep Katie clean?
Okay, very good. Alright, how are you so far?
Good.
Okay, we just have a little bit more to do. Okay, so now I'm going to be checking your palate. Can you just say ah and try to hold it for as long as you can? Alright, can you try?
Ah.
Okay, very good. Alright, can you try repeat this sound for me? Okay, I'm going to do it first. Okay, can you repeat? Okay. Alright, now we're going to try zzz. Okay, I'm going to do it first. Okay, that's very good. Okay, can you try cough for me as strongly as you can?
Cough.
Yes, cough. Okay, very good. Alright, now we're going to be checking your breathing rate. So can you try to breathe in and out for me as normally as you would? Okay, very good. Okay, can you try swallow your saliva for me? And before you, as you swallow, I'm going to just hold my 2 fingers under your chin just to check your swallowing. Okay, so can you try swallow? Okay, very good. Alright. So now can you just try to hold your breath for as long as you can? And I'm going to be starting a timer for that. Alright, how are you doing so far?
Good.
Okay, good. Alright, so I'm just going to start. And are you ready?
Yes.
Okay, so I'm going to start in 3, 2, 1. You stop anytime you don't feel comfortable, okay? Okay, alright, good. Alright, so now we're going to have a snack. So can you eat this and just chew for the time being? How does it feel? Hard. Very hard? Yeah. Okay, when you're done chewing, can you just show me what's in your mouth? Okay, very good. Alright, so now, as you swallow, I'm just going to be putting my fingers under your chin like just now. But this time, you wait for me to say swallow first, then you swallow, okay? Alright. Can you swallow? Okay. Very good. You want some water with that? Alright. So now, we're going to do the exercise again. Alright, so can you just say for several seconds like this? Okay, very good. Now, can you say again, but this time you have to, so like this. Okay, can you try? Alright, very good. Okay, now can you turn your head and then say Okay, now for the final one, just raise your chin and say Alright, very good. Okay, so thank you so much, Miss Hidayah, for today. I will let you know the scores in a little bit. Okay.
For components such as respiration and trachea, please assess the status of the patient by consulting either her medical officer, nursing staff, physiotherapist, as well as her pulmonary physician. So moving on to the scoring and interpretation of the screening test, that is Mann's assessment for swallowing ability. So in order to obtain the results of this screening test, what you must first do is add up all the scores from each individual item. So once you've added all of that up, you will obtain the final score. So Miss Hidayah, she had the final score of 166, which indicates that she has mild dysphagia and/or mild aspiration. And so, as you can see on the last 3 items of the MASA scoring sheet, the therapist will then be able to provide recommendations to Mrs. Hidayah for her fluid and dietary intake. And on the last item, for swallowing integrity, the therapist will then be able to assess that Mrs. Hidayah does have the possibility of having dysphagia and aspiration, and she will be able to conduct further assessments into confirmation of the results of MASA, and also to aid in future interventions of the patient.